Hello, my name is Ujcic III. My client this week is Thomas Piper. He's 35 years old, and his differential diagnosis is voyeuristic disorder. The primary diagnostic features for this diagnosis are 1. Sexual urges, fantasies, or behaviors involving observing strangers who are naked, undressing, or engaging in sexual activity. And 2. Sexual urges have been experienced for at least 6 months. Alright, let me give you Thomas's story. He's 35-year-old business executive, good-looking guy, successful. He has a very active sex life. Normally, he goes out on weeknights and meets women, goes on dates, and pretty much always has sex with them. And he said he was satisfied with this lifestyle. But then about 8 years ago, he moved into his first high-rise apartment downtown, and his brother bought him a telescope to look at the stars with. And he set it up, and he just happened to catch a woman undressing in a window the first time he used it, and he decided to watch her undress, get naked, and he masturbated, and right after that, it started to become a thing for him, looking in people's windows and finding women to masturbate to. It happened quite often after that, pretty much weekly, pretty much daily. And then more recently, he has been caught actually twice. First time he got caught watching a couple have sex, and the man came after him and said, "I'm gonna bash your head in." Obviously, that's a bit alarming. Then, so he stopped after that, but then he got back into his whole peeping routine. And he got caught again. He was masturbating like outside someone's window, and some woman caught him and was filming him and said she called the police and all this. He ran home, and ever since that night he was like super stressed out, and he was thinking, oh my god, the cops are gonna come after me, for a long time. And basically because of this, this is why he's seeking treatment. Never been married, so on and so forth. Let me read you some of his key things here. The unusual sexual activity began 8 years ago when he moved into his high-rise apartment. That's important to know. Thomas changed his view of doing no harm the first time he was almost caught by the next door neighbors and of the woman who caught him and said he was on video. So that's when he changed his opinion that he thought he wasn't hurting anyone. And then he's 35 years old, so he's over 18. Next is his multi-axial diagnosis, which I will give you right now. Axis 1 is voyeuristic disorder. Axis 2, 3, and 4 are all none. And axis 5, his GAF is 80. So he's functioning, but he could use some help. The theoretical perspectives are as follows. There are 2. Biological. The neurotransmitter serotonin may be in a deficit, and there is a possibility of a normal amount of dopamine released, but it is secreted during the act and after, and therefore creates a pleasure response and increases likelihood of the act reoccurring. So he masturbates and comes, dopamine is released, and that increases the likelihood of him doing it again. This is clearly demonstrated in the client's repeated peeping Tom behavior. And 2, behavioral. There are 2 false learning experiences which may have taken place. The first of which is classical conditioning, with the stimulus being the voyeurism act, with the response being sexual arousal. The second is operant conditioning, Because it feels good to become sexually aroused and reach climax, it increases the likelihood of the act reoccurring. So, and then this is demonstrated in the client's repeated peeping Tom behavior. Once again. Thank you very much. That has been Thomas Piper. Have a nice day.